So as far as the treatment options for sleep apnea, CPAP is the one that everybody hears about, and that option is misused by the medical community.
Absolutely.
And the number one through probably 20 reasons why people hate their CPAP machines is because their nose doesn't work properly. And if you have a CPAP machine and your nose doesn't work properly, it's gonna be a struggle.
It's a miserable experience, yeah.
We would not, we prescribe CPAP machines when appropriate. We will never prescribe a CPAP machine to somebody whose nose doesn't work, because it's, in my opinion, malpractice is a strong word, but it's setting yourself up for failure, and that's not appropriate.
And it's why compliance rates are 30%.
Yeah.
So how would you feel good about giving somebody something, saying, hey, this is your treatment option, knowing that the chance of them being successful with that treatment option is low out the gate anyway, but then they have a nose that doesn't work, and it's like really expecting them to be successful with that. And it's why people have to go from maybe less cumbersome, claustrophobic options with their CPAP machine to a full face mask, which I can only imagine is, I've never worn one, but patients.
Well, yes, absolutely. I mean, think about how fun, if you want to have fun, you got, how many holes in your head do you have to breathe through?
Oh, breathe through. Three.
So
Okay.
three is the answer. If you have two of them compromised, if your nose doesn't work,
Right.
that's two compromised.
Right.
And so if you want to have some fun, you got somebody who's, and if you have sleep apnea, the third hole, your throat is compromised. So you got, your nose isn't working, your throat is tight, and just for kicks, let's put something over your nose and your mouth, both, and have you try to sleep with that.
Right.
Like that, that is insane to me. It's insane that anybody with a right mind, and you don't even have to have any medical, forget your medical degree, you take a 5-year-old and say, hey, dude, here's what we're gonna do. We're gonna plug your nose up. I know your throat's, whatever. We're gonna put this thing on you. How do you think you're gonna do with that? And anybody who's a living, breathing human being is gonna say, no.
It's like drowning with air. It's got to be.
And that's the claustrophobia. I don't know. I'm not a psychiatrist or psychologist. My understanding of claustrophobia is that it's here. Like your brain is saying, this is a problem. I'm feeling suffocated.
Right.
Is it really claustrophobia if you actually are suffocating somebody? You know what I'm saying? If I have my hands around your throat and I'm strangling you, and then I give you a diagnosis of claustrophobia, is that appropriate? Is it really claustrophobia, or is it my hands that are strangling you?
Yes.
If I'm a lung doctor and I see you that has a nose issue and a throat issue, and I throw a mask over your face and hook you up to my brilliant machine over here, how is that any different? As far as like, that's just as wrong as that. And then to turn around and say, buddy, it's your problem, man.
Right. You're non-compliant.
You're not using this thing, man. You're not using this. You're not doing the right thing here.
Right.
Why? That's
and to make somebody
insanity.
feel guilty for not using that and not wanting to take back control of their sleeping or their life, which is really, really frustrating to hear when patients feel not heard for that reason alone. Like imagine that patient who walks in and it's a month and they've been struggling with that machine. They're sitting down with whoever that doc is, and they run over their compliance report, and they're like, what's the deal here, man?
Yeah.
How can you not tolerate this? Like, you're going to die if you don't wear this thing, And so, I mean, and conceptually, like, CPAP machines have become more sophisticated, but the concept has not changed. It's still something pushing air into your nose and or mouth.
Yep, absolutely.
Like you can put all the bells and whistles you want on that, but that's still, that is still the same that it was however many years ago that was first introduced. And so, optimize that patient to do as well as they can with that machine and help them feel empowered. And if it's not going to work, pick something else.
Right. Why? And I guess just to get to why are CPAP machines used as a weapon often? How has that situation happened? Why is that? Why if by every measure, nasal obstruction is the #1 reason that people can't tolerate a CPAP machine. Why isn't that addressed commonly? It's uncommon. Our approach is uncommon. Our approach is uncommon.
Right, because it can't be. Because whoever might be prescribing that. Now, granted, like, obviously we're throat surgeons and we have the ability to make change in those areas to try and help prime that patient. But if your only means to treat something is a CPAP machine, that's your only means to, like you're not going to be able to address these other issues. So they can't address those other issues. So they will use your CPAP non-compliance as the reason why you're just not doing what you should be doing for yourself.
Right. Yeah, because they're not nose and throat doctors. I don't know. I mean, I guess so in our specialty, ear, nose, and throat, otolaryngology is the fancy name for it. That's where these issues lie. These issues are absolutely in our wheelhouse. That's our territory. The throat, the nose. That's where these issues are coming from. And so if somebody's in our office and has nasal obstruction, and they may or may not know how impactful they may not know that it's a big bother to them. But if they have sleep apnea, it's on our shoulders to identify that, treat that, get it out of the way. The challenge with the nose is it's out of sight, out of mind for a lot of folks. Every other specialty has no idea what they're doing in relation to somebody's nose. Like it just is. It's hidden away. Nobody knows what's going on in there, and so if somebody's got nasal obstruction or is intolerant with the CPAP, there's no way around that. They might, hand you a bottle of Flonase and let's cross our fingers and hope, but that's not likely going to get you where you need to be. And so,
right.
Yeah.
And I would say that even within our specialties too, it's important that, if you have nose procedures and the outcome is good, it means you should be breathing through your nose. Mm-hmm. And so. And that's just important too, that people may have had other things done in the past and still can't breathe, and it's still worthwhile being evaluated, being addressed, because it may not be as good as it can and should be.
Right. Yeah, and that's true too. So with CPAP machines, it's a machine that's sitting on the bedside. There's a hose that comes off of that, connected to a mask, and there's a variety of different masks, but there's really sort of only two different types of masks. There's a full face mask, and then there's a nasal mask, and there's again sub varieties there. A nasal mask is always better than a full face mask when somebody can tolerate a nasal mask. The only reason that somebody needs a full face mask is if they drop their mouth open. The only reason that the body would choose to drop the mouth open is if somebody's nose doesn't work. So sometimes though we will see somebody who is a mouth breather because their nose doesn't work. Will fix their nose, and sometimes they'll still be in the habit of dropping their mouth open. But every day of the week, every day of the year, kind of a thing, knows that the mouth shut, nose open is how you're meant to breathe. But the most common mask that's prescribed for people who have sleep apnea is a full face mask because it's the default easy option. If you can't fix somebody's nose or identify an issue with somebody's nose, let's just forget about it. Let's put a full face mask on, and then like I said before, that's certainly going to give you claustrophobia. If you thought you had a sleep problem coming into your sleep study, we're going to give you a real sleep problem. We're going to that airway that you were barely hanging in there with. We're gonna sort of put our boot on your throat and see how you like it, kind of a thing. It's just insanity.
And the other thing to keep in mind too is that compliance is defined as 4 hours of sleep per night. So like, what person in their right mind feels like if they get 4 hours of sleep a night, they're going to feel refreshed, right? So to define compliance nationwide or even worldwide is like, okay, as long as you wear this machine 4 hours per night, you're good.
Right.
Like, you're not good.
Yeah,
and like, and then you rip it off. Like
even by that ridiculous definition of effectiveness of 4 hours of using this machine per night, the success rates are about 33%. So even when you set the bar so low that you don't think you can get any lower, you're going to fail 2 out of 3 times that you're going to give that thing to somebody.
Right.
Which is ridiculous, and anybody who says it's not ridiculous, and anybody who sort of massages. So all the reason that 4 hours came into play is it's like, how can we make this construct be palatable for the world? This thing is ridiculous. Like, the whole construct is ridiculous. Let's put it in a nice, pretty box, and we will send it out in the world and hope that they don't figure out how ridiculous it is.
And they didn't ask the question about, like I think some of the studies maybe looked at, okay, well, maybe it lowers your risk for certain things as long as you hit a minimum threshold of 4 hours a night. But the problem is it doesn't make anybody feel better, and so a lot of like sleep apnea is how do I feel when I wake up in the morning? Do I have energy to hang out with my family and kids? Do I have energy to be at work? Like all these things that matter to somebody's daily lives, because it's already hard for them to conceptualize, well, my risk of having a heart attack is 5x over the average person 20 years down the road. Like that's already a hard thing to conceptualize. So for them, it's what matters daily for them and how they feel. And so 4 hours ain't gonna get them there. So like I would say, hey, you should get 6 to 8 hours of sleep. If that's the sleep you need to feel good, then that's the sleep you need with your CPAP machine on or an oral appliance in place or something else to feel good.
Yeah.
Like period end, right? Like that would seem to make the most sense to me.
Right. And if you flipped it the opposite, if you wanted to screw somebody's sleep up definitively, you would just compromise the airway, even just a little bit.
Right.
So if so basically, I don't think anybody really would argue with the fact that for most people, 6 to 8 hours of sound, restful sleep. That's what most people need, and if you can have it, that's what you should try to shoot for. You know, if we wanted to mess it up, well, you decrease the number of hours. Okay, that can do that, or you decrease the ability to breathe properly.
Yeah, the quality, right?
That's absolutely going to minimize that. So yeah, instead of shooting for 4 hours wearing a machine, let's shoot for 6 to 8 hours, and if the machine's necessary, fine. But 6 to 8 hours with a proper airway is what you need to sleep properly. And
Right.
unfortunately, millions of people, a quarter of the population, are walking around with airways that aren't conducive to proper sleep.
Right.
And so, what are you going to get at? What's the end result of that? Is you're going to get crappy sleep when you're sleeping, and you're not going to sleep as long because it's crappy.
Right, and to the people out there that say, oh no, I need 10, 12 hours, or it's the quality, not the quantity, but of course there's a minimum quantity, right? Like we said, 6 to 8, but then there's people who like, oh, I don't feel rested after 10 or 12, and like, hey, that's a good sign that you have sleep apnea, or something. Go seek help with us or whoever, but like, ask the question, do I have sleep apnea? Because if you're getting 10 to 12 hours of sleep and it's still not restful sleep, that's where the quality of sleep is off, big time.